It is Sunday. Happy Sunday Night Live, everybody. This is Nurse Eunice with Florida Training Academy. And in this evening's video, we're going to be covering body systems. We're going to be covering the musculoskeletal system and also the integumentary system. So I look forward to speaking with you all shortly. We'll give you about 10 seconds to get your notifications and we will get started. Hello, everybody who's already in the chat. And let's see who we have. Looks like we have Zanib, we have Cecilia, Alexandra. Let's see who else. I don't want to mispronounce your name, but we have Beatrice, we have Betty, Camille, and then Mesadieu. All right, so I'm sorry if I butchered your name, but let's get started, everybody. Question number 1. And I see a lot of you already have the answer in the chat, but what is osteoporosis? Is it A, inflammation of the joints? B, a disorder where the immune system attacks muscles? C, a condition where bones become weak and brittle? Or D, a congenital deformity of the spine? What do you think the answer is? Yes, Adelina, I had a late night live, so I'm happy you could attend. Thank you so much. All right, everybody, revealing the answer in 3, 2, and osteoporosis is actually C. It's a condition where the bones become weak. So osteoporosis is characterized by decreased bone density, making bones fragile and more prone to fractures. It often affects postmenopausal women and the elderly. Question number 2, we're going to learn about these bones today and also the muscles. Question 2, which patient is most at risk for developing osteoporosis? Is it going to be a 22-year-old male who exercises regularly, a 35-year-old pregnant woman, a 45-year-old man with a sedentary lifestyle, or a 40-year-old postmenopausal woman? Now, this one should be easy because I kind of gave you the answer already. Who is most likely to have weakened bones? That's right, Sherry. All right, so it is going to be D. Remember those hormones, the estrogen in our body. Whenever a woman is postmenopausal, she's losing some of those hormones, and those hormones help to build up those bones. So postmenopausal women are at higher risk due to decreased estrogen levels, which impact bone density. And that's also why you will see your elderly patients get shorter and shorter. They start shrinking because of the lack of estrogen. All right, question number 3. I know you got this one. What is the primary symptom of osteoarthritis? The primary symptom of osteoarthritis. All right, we'll give you a few moments to put those answers in the chat. All right, revealing the answer in 3, 2, and yes, you are right. I see a lot of A's and B's and C's, but a lot of A's. So osteo being bone, arthritis, inflammation of like the joint, causes wear and tear of joint cartilage, leading to pain and stiffness, especially after activity. So osteoarthritis. Question number 4. Which intervention is appropriate for a patient with rheumatoid arthritis? If you've ever seen anybody with like those swollen fingers, the swollen joints on the fingers, that's a sign of rheumatoid arthritis. So what would be an appropriate action? Do we want to apply cold packs to inflamed joints? Heat packs to inflamed joints? Do we want to limit their fluid intake? Or do we want to recommend high impact exercises? What do you think, team? All right, revealing the answer in 3, 2, and yes, you all have it. Yes, it is B, and the crowd goes wow. So we're going to apply heat packs to inflamed joints. So heat can help relax muscles and reduce joint stiffness. Rest is also important, but activity should be balanced. So you're not going to, try to make them do more activity than normal. And with most of your facilities, you're going to, of course, need an order order for a heat pack or a cold pack, but we usually don't keep those on the patient's skin for longer than 5 to 10 minutes. And you want to be checking to make sure that it's not too hot and or too cold, depending on the therapy that the physician has ordered. But yes, you as a CNA, as a PCT, you will be helping people with their warm or cold compresses. All right, question number 5. Which of the following is a hallmark sign of gout? Is it A, bone deformities, B, muscle cramps, C, widespread joint pain, or D, pain in the large toe? And some of you all are so funny. You're like, Nurse Eunice, why do I need to learn all of this? Is this going to be on my CNA test? It may not be on your CNA test, but after you pass your CNA test, you're going to go in a facility and one of your patients is going to have gout or they're going to have osteoarthritis. So it's something that you need to know about so that you can provide holistic care. All right, everybody. Yes, you got the answer right. Gout. Ouch. That's why we don't just want you like pulling on people. You know, they may have socks on. Just don't press on their toes because you don't know what's under those socks, because gout causes pain. Gout commonly affects the big toe, causing severe pain, redness, and swelling due to uric acid crystal deposition. In other words, they're eating too much of something that's bad for them, but I can't tell you just yet because I'll be giving you a test answer in advance. So, but this is an example of what gout would look like. Question number 6, and we're moving fast. We're not going to do all 100 questions tonight, but we will do 50. Question number 6, a patient with a fracture is placed in a cast. What is a sign of compartment syndrome? Is it A, itching under the cast, B, warmth and redness around the cast, C, numbness and increased pain in the limb, or D, decreased range of motion? All right, and we have some awesome viewers on tonight who are studying with us live. We appreciate you all so much. All right, I'm giving you a few more moments to put your answers in the chat. All right, revealing the answer now in 3, 2, and all right. And Empress, I'll go back and answer your question shortly. It is C. So after an orthopedic injury, that joint, that extremity can still swell. And so even though our practitioners, our doctors try their best, sometimes they can put a cast on that initially isn't too small, but due to the swelling of that extremity, the cast can start cutting off circulation. So you always want to look for signs of poor perfusion anytime someone has a cast, and you can tell if a person doesn't have proper perfusion because number one, they could be complaining of pain, but if they're nonverbal, you can also check the pulse and you can look for the coloration. So compartment syndrome occurs when pressure builds up in a muscle compartment, leading to pain, numbness, and decreased blood flow. All right, and so Empress had a question, you all, so let me go back to that one. And so Empress's question was, how do I start your CNA program if I live in a different state than Florida? Empress, I'm going to recommend that if you don't plan on working in Florida, or that you really do your research first, because we have a hands-on class here in Jacksonville, but Florida lets you challenge the test and not all states allow you to do so. We also have an online CNA exam prep class for $29.99 per month. That one is good for all 50 states and also for our international students. But again, you want to check with your state where you're going to be working so that you understand exactly what's going to be on that test. And I'll put our email address in the chat, and you can email your exact questions to admin@fltraining.com. My office manager will filter the emails, and if she can't answer the question, then of course I will do so for you, but I need to know where you're located. All right, so question number 7. Which nutrient is most important for bone health? Is it vitamin C, iron, calcium, or potassium? Now, they're all important, but which do you think is the most important? That is right, Miss Bonita and Beatrice and Elaine and Sherry. And you're going to have to pronounce your name for me. I'm just going to keep calling you Zanib. The last tribe, you all have it. It is calcium. And think about those calcium rich foods. So, of course, dairy products, but also some nuts and legumes or beans. So, calcium is essential for maintaining strong bones and preventing bone weakness, aka osteoporosis. Question number 8. What is scoliosis? Is it A, condition where the spine curves sideways, B, a narrowing of the spinal canal, C, a fracture of the spine, or D, a herniation of the intervertebral disc? And don't be talking about how I'm pronouncing these words tonight. Y'all know it's 10:45. It's beyond my bedtime. And that's right, Princess and Laura and Pauline. Scoliosis, it is A. It is condition where the spine curves sideways. So scoliosis is an abnormal lateral curvature of the spine, often diagnosed during adolescence. Question number 9, team. We're moving right along. Which patient care strategy is important for a patient with osteoporosis? Is it A, encourage high impact exercises, B, avoid weight bearing activities, C, limit calcium intake, or D, use fall prevention measures? And I need my lips to catch up with my brain. My brain is reading it right, but my lips are not letting me say it correctly. And so it is D. And so why is that important? Because you're going to be taking care of patients who are going to be at risk of falling because of osteoporosis. But then don't forget that if they do fall and they have weakened bones, they are more likely and more susceptible to have a fracture. So it's really important. Make sure those patients have their fall risk armbands, but that you are doing everything in your power to also prevent those falls. So patients with osteoporosis are at high risk of fractures. So fall prevention strategies reduce this risk. Question number 10. What is a common complication of immobility in patients with musculoskeletal disorders? Is it A, increased appetite, B, pressure ulcers, C, improved muscle strength, or D, enhanced bone density? And Ariana, thank you for joining us and studying. Look, I am a lifelong learner also, so I do agree. It's just nice to sometimes to get a quick refresher. So thank you for joining us. Oh, and you all are giving me so many answers. I see B's, C's, and D's. And so anytime someone is immobile, that means they can't move on their own. And that means that they are more likely to be at risk of pressure sores. It is B. So immobility can lead to decreased circulation and increased pressure on skin, causing ulcers. So 10 is B. Question number 11. Oh, what causes gout? I already gave you this answer. Let's see if you can remember it. Is it A, lack of vitamin D, B, decreased calcium absorption, C, autoimmune response, or D, excess uric acid in the blood? I see you, Tony and Adelina and Marie. I see you, Gertrude. Yes, you all have it. It is D. And so they've been eating too much processed or too much processed foods or too much liver. And also beer can increase uric acid levels. So gout is caused by a buildup of uric acid in the joints, and that's what causes that inflammation and pain. So usually diet changes, increasing water intake, and if that doesn't work, then the doctor can put them on a medication to decrease their uric acid levels. But prevention is key. Question number 12. Which of the following is a sign of a hip fracture in the elderly? Is it A, difficulty speaking, B, generalized aches and pain, C, shortened or externally rotated leg, D, redness and swelling in the fingers? How do you know if Mrs. Parker, who fell, has a hip fracture? And you're not the nurse, you're the CNA, you're the one who's assisting the nurse. But maybe the patient fell and no one knew, and now you're given a bath and something doesn't look right. This should alert you to alert the nurse. And that answer is going to be I tricked you. It's not generalized because generalized could just be from arthritis. But if that leg is shortened or if the leg is rotated inward, that could be an indication of a hip fracture. So the answer is C. All right, question number 13. What is the primary treatment goal for a patient with a herniated disc? Oh, so you got your first job as a CNA and you are on the orthopedic unit. So these questions relate to all of your patients on that particular unit. So is the goal for somebody who has an herniated disc, is it going to be to prevent bone deformity, to relieve nerve compression, to strengthen the immune system, or to increase blood calcium levels? What do you think, team? Oh, this one's tricky. Think about herniated disc. Oh, when that disc protrudes, it presses on a nerve. So give me another answer. The answer is not A. Iffy Annie, I think I said it right. You have it. So yes, Sherry, it is going to be B. We want to relieve the nerve compression. So they will be on bed rest. They may even end up with some type of neck brace, but a herniated disc can press on spinal nerves, causing pain and discomfort. So the goal is to relieve this pressure. I'm happy I'm teaching you all something new tonight. Question number 14. Which musculoskeletal condition is characterized by widespread musculoskeletal pain and fatigue? This one's a hard one, so get your pen and papers. If you're not taking notes, you should be, because your patients are going to have multiple conditions and they might have this one. So is it going to be osteoporosis, rheumatoid arthritis, fibromyalgia, or scoliosis? Widespread pain and fatigue. I think I see a few correct answers. I think I saw two correct answers so far. I think it's Alexandra, Kemi Suze, and I apologize for messing up your name, Elaine. So yes, you all, this is a new term for a lot of you. It is fibromyalgia, and it affects a lot of women. So fibromyalgia involves chronic, widespread pain and often coexists with fatigue, sleep disturbances, and memory issues. So they used to say, oh, she's just going through something. Yeah, she has fibromyalgia. The doctor just hasn't diagnosed it yet. So sometimes your patients aren't lazy. They actually have conditions that haven't been diagnosed. So encourage those women in your life to go to the doctor so that we can find out where they're always in pain and why they are always tired. Question 15. Which intervention is appropriate for a patient with fibromyalgia? Is it going to be high intensity exercise? Do you want them to avoid physical activity? Do you want them to decrease their fluid intake? Or would you recommend a balanced diet and low impact exercise? And every one of you you're going to get this right. I got so much faith in you. Revealing the answer in 3, 2, and I knew you knew that one. It is D. Low impact exercises and a healthy diet can help manage fibromyalgia symptoms. Question 16. You got to get this one right. What is the term for inflammation of the bursa? Don't make this hard, y'all. Is it A, osteoarthritis? Is it B, tendonitis? Is it C, bursitis? Or is it D, synovitis? That's right. Don't make it hard, Tony. Don't make it hard, Adelina. Chris Love, if the bursa is inflamed, it's going to be Bursitis. It's going to be C, y'all. Remember, itis is inflammation. So, bursitis is the inflammation of the bursa, which is a fluid-filled sac that reduces friction in the joint. So, you all are going to have to learn some prefixes and some suffixes. I have multiple videos on those, but itis can mean inflammation. It can also mean infection. So, if you see that at the end of a medical term, you may not know what it means, but just know that something is inflamed or infected. That'll at least get you in the ballpark. Question number 17. What is the most common site for osteoarthritis? Would it be the knees, the shoulders, the spine, or the elbows? Now, I'm in Florida and we do a lot of dances. Yeah, we be scrubbing the ground and doing all these crazy dances, and then we get old and we all have the same issues. Yep, our knees hurt. So it is A. Osteoarthritis commonly affects weight-bearing joints such as the knees, the hip, and so if you chose the spine, you're also correct, but it's most commonly one of the first places will be the knees. Question 18, team. What is a priority in caring for a patient with a cast? Is it A, use a hair dryer to dry the cast quickly, B, keep the cast covered with plastic at all times, C, monitor for circulation issues in the extremities, or D, apply lotion to the skin under the cast? And if you've ever had a cast, yes, it's very uncomfortable. And yes, everybody got it right. Woohoo! It is C. We're monitoring for circulation. So, monitoring circulation ensures there is no compromise to blood flow, which can cause complications. And it may be a little hard for you all to see, but this image shows somebody with discolored feet and also hands. So, this does not look like normal perfusion or normal coloration. If you saw this on your patient, you want to notify your nurse right away. Question number 19. Which condition is caused by repetitive motion and affects the wrist? Is it A, carpal tunnel syndrome, B, gout, C, bursitis, or D, scoliosis? All right, revealing the answer in 3, 2, 1. And whoever put in the comment that you're late, you're not late. You're right on time. We're happy that you joined us. It is A, carpal tunnel syndrome. Give yourself applause. So carpal tunnel syndrome results from the compression of the medial nerve in the wrist due to repetitive motion. And if you are typing and you're starting to feel some type of pain in your wrist or numbness in your fingers, don't forget that they have little mouse pads or keyboard pads that can provide cushion and support that will help reduce those symptoms. Question number 20. Hello. Hey, T. Congratulations. I'm so proud of you. All right. I'm so proud of you. All right. So, question 20. This one's hard, you all. What is the key feature of Paget's disease of the bone? We don't see this a whole bunch anymore, but if you're working with pediatric population, I need you to know what Paget's disease is. Is it going to be A, decreased bone mass, B, disorganized bone remodeling, C, joint deformity, or D, excessive calcium absorption? All right. And Antonia says, I start my program tomorrow. Any tips? Get some sleep. Eat a good breakfast. Make sure you have pen and paper with you. Take good notes. You are going to do well, and your instructor is going to be fabulous. And you're going to have some great peers. You're going to have a great cohort of students that you can learn with and who will become your lifelong friends. That's the tip that I have for you. You're going to do well. So you all, for Paget's disease, remember this is something that you may not have seen before, but for Paget's disease, the answer is actually, and make sure I chose the right one, It is B, disorganized bone remodeling. Fancy term. Yes, there is some joint deformity, but Paget's disease involves abnormal bone remodeling leading to weak, enlarged, or misshapen bones. If you're not working in peds, you probably won't see this too often, but if you ever see somebody walking down the street as an adult and you see like, wow, why is his leg bowed out like that? It was because as a kid, he or she may not have gotten the treatment they needed, and more than likely, they had a diagnosis of Paget's disease. All right. Oh, IG, I'm sorry to hear you did not pass your test, but hopefully you got your notes or your report from your nurse and you know what your weak areas are. And I want you to go back and really study those weak areas, okay? And ask your professors for additional support if you need it. Question 21. What is the most common cause of lower limb amputations? Is it trauma, infection, peripheral vascular disease or PVD, or bone cancer? What is a cause of lower limb amputations? And good luck, Laura. Revealing the answer in 3, 2, and I see you. So many great answers. I see why you chose B, but it's C. Maybe back in the day, due to like gangrene and uncontrolled diabetes, it was infection, but currently it is C. Most amputations are caused by peripheral vascular disease due to poor circulation and also diabetes. So, not necessarily infection, it's the lack of blood flow. And that is the leading cause of lower limb amputations due to the death of the tissue because the circulation gets really, really poor and the tissues die. And the doctor tries to save the limb by maybe taking off a toe, and then they'll do maybe the ankle area. And unfortunately, it could go up to a below the knee amputation. And if that doesn't resolve the issue, then they may have to go above the knee. But the doctor really tries to preserve as much of the limb as possible. Question 22. What is the primary nursing intervention for a patient post-amputation? Remember, today you're on the orthopedic unit. These are all your patients. So, patient just had an amputation. They're back from surgery. Do you want to do A? Do you want to elevate the stump for 24 to 48 hours? Do you want to avoid range of motion exercises? Do you want to do C, keep the stump covered at all times? Or D, encourage lying in the supine position continuously? What do you think? What do you think? I love introducing new concepts to you all. So, everybody, Marie has it. Yes, Marie. And Adelina, yes. So, I don't expect you all to know this stuff, but we have to elevate that stump. It is going to be A. And we start moving them like they have physical therapy the same day. If they had their surgery in the morning, they're having physical therapy that day. So, we don't necessarily keep them in bed all day just because they've had a surgery. But elevating the stump reduces swelling and promotes healing. But we only do it for a short period of time, because if we keep that hip elevated or that leg elevated, they can actually get stuck, and we call that a hip contracture. So we're going to keep it up for about a day to prevent the inflammation, but then after that we got to start moving it, and we're going to encourage that patient to move the limb also. Question 23. Which sign suggests the presence of osteo, being bone, myo is usually musculitis infection? So which of the following suggests the presence of osteomyelitis? Is it A, joint stiffness and swelling, B, localized pain, redness and fever, C, muscle weakness and cramps, or D, tingling and numbness in the extremities? So remember, if you only know the prefix or you only know the suffix, you got to learn some type of medical terminology in order to pass your CNA test. So, with what you know about this particular term, osteomyelitis, what do you think the best response is? Revealing the answer in 3, 2, and I see you, Zanib. Yes, it is B. All right, so let's talk about itis, infection, or inflammation. If something is inflamed, it's going to be painful, it's going to be red, and if they have an infection, more than likely they are going to have a fever. So osteomyelitis is a bone infection, and the symptoms include all of those terms which I just mentioned. And you, as the CNA, when you go in and you get your vital signs and you see this person's temperature is elevated and you see that, wow, this leg or this, this limb is really red, you're not the nurse, but you can put 2 and 2 together and kind of think of where the infection is coming from and go out and tell your nurse whatever the abnormals are. So Nurse Eunice, I went in and checked on Mr. Lucas. His temperature is 102. And by the way, 102 degrees Fahrenheit. And by the way, I looked at his toe and it is red. You may want to check that out. That's all you got to do. That's how you be a team player. And I love it. Question 24. What is a priority treatment for osteomyelitis? Is it going to be A, surgery to remove the affected bone, B, application of heat packs, C, immobilization of the joint, or D, long-term antibiotic therapy? Think about it. Somebody has an infection. What do you think the therapy is going to be? And if you chose, yes, if you chose D, you have it. That is right. Come on, y'all. Make those brain cells work because you're going to be on the floor on the orthopedic unit. And these patients are going to have bone infections and skin infections. And one of the common medications that's going to be hung is going to be an antibiotic. So osteomyelitis is treated primarily with antibiotics to target the infection. Severe cases only may require surgery. Question 25. What is a common early symptom of bone cancer? Is it muscle twitching? Acute means that it occurred recently. Acute and localized bone pain? Is it C, persistent and localized bone pain? Or is it D, joint stiffness? Bone cancer. Does cancer present itself rapidly or does it grow over time? And that's going to help you answer this question. And if you chose my heart, oh, I love y'all. I'm not turning on this camera because I don't have on any makeup, but you all are right. It is C. So persistent and localized pain. Bone cancer often presents as localized pain that worsens over time and it doesn't improve with rest. Their leg is still hurting. Something doesn't feel right. It's an internal pain. It's a deep pain and nothing they're doing is relieving it. They're going to go get an x-ray eventually, and that x-ray may show an abnormality, and that's when we start doing the other tests, such as the MRI or a CAT scan. All right, question 26. Which individual is most likely to receive a diagnosis of bone cancer? Is it going to be a 5-year-old child with persistent bone pain and swelling? A 25-year-old athlete with a history of repeated bone fractures? A 45-year-old office worker experiencing occasional joint stiffness? Or a 70-year-old retired teacher with osteoporosis? Some of you are going to be working with peds. And when you're working with peds, you have to know some new conditions. All we talk about are adult conditions. I need for you to know that usually bone cancer that is not from metastasis or from it spreading from another area is most commonly found in the pediatric population. So the answer is A. So bone cancer, particularly osteosarcoma, is most commonly diagnosed in children, teenagers, and young adults, with the peak incidence during periods of rapid bone growth between the ages of 10 to 20. So persistent bone pain and swelling are the hallmark symptoms. Some of the other types of cancer, there are other types of bone cancer that's found in kids, but whenever an adult develops bone cancer, it's usually due to maybe they had cancer in the breast, and then from there it went into the bone, it spread. Question number 27. Which intervention is most appropriate for a patient undergoing chemotherapy for bone cancer? All right, so today you got floated to the oncology unit. So normally you're on the orthopedic unit. Today you're on the oncology unit, and this is where the patients receive chemotherapy and radiation. So are we going to do A, encourage a high protein diet to support healing? B, restrict fluid intake to reduce swelling? C, avoid frequent repositioning? Or D, promote weight-bearing exercises? And I need you to see it before you see it. I need for you to kind of visualize these patients, because you won't be able to go to every patient population before you take your CNA test. You won't be able to go to all these different units. So a patient who is undergoing chemotherapy is going to need, yes, it is A. We're going to encourage a high protein diet to support healing. Look, we know when they have chemotherapy, it changes the taste of foods. They start losing their appetite. And so you want to encourage protein-rich items, which could include supplements such as a Boost or an Ensure, and also puddings. Yes, we can put protein in a pudding. It's going to taste like chocolate, but it's packed with the good stuff. So a high protein diet helps the body repair and recover from the effects of chemotherapy and cancer. Question 28. Phantom limb pain occurs due to, is it A, poor circulation, B, damage to nerve pathways, C, immune system response, or D, infection at the surgical site? And so phantom limb pain it happens after an amputation. The patient still can feel a toe that is no longer there, and it still hurts. That's phantom limb pain. So, yes, it is due to B, damage to the nerve pathways. So, phantom limb pain arises from nerve damage and misinterpretation of signals in the brain. It can persist after an amputation. So, yes, the person whose leg was amputated will still have some type of residual pain, because the nerves that were cut off still think that the remaining portion of the leg is there. So, that is a real phenomenon, and I want you to be aware of it. Question 29. Oh, this one's hard. What is a key nursing consideration for a patient with bone cancer, osteosarcoma? Are we going to do A, monitor for signs of hypercalcemia? B, encourage frequent bed rest? C, apply cold compresses to the affected site? Or D, limit intake of dairy products? And if you're not a nursing student, this one is probably a little bit above your knowledge area, so I'm not going to prolong this one, but you all don't know that I trick you. I am not preparing you for a CNA test. I am preparing you for nursing school. Ha ha ha, you got tricked. I'll see you in nursing school in about a year. All right, so for this one, the answer is A. So osteosarcoma can increase bone breakdown, leading to elevated calcium levels in the blood. So when the bone breaks down, the calcium is released, and so this person can have hypercalcemia, which can cause cardiac arrest and muscle issues, etc. So a little bit too much for my CNAs, but perfect for my future nurses. Question number 30, true or false? CNA. Lactose intolerance means a person is allergic to milk. Is that true or false? Revealing the answer in 10, 9, 8, 7, 6, 5, 4, 3, 2. Congratulations. I'm so proud of you. I tricked you all. It is not true. It's false. So it's not that they are allergic to milk, They are allergic to the enzyme, the lactose, the milk sugar. So the answer is false. Lactose intolerance is caused by a deficiency of lactase, the enzyme that breaks down the lactose. It is not an allergy, but rather a digestive issue. Milk allergies involve the immune system reacting to milk proteins, which is different from lactose intolerance. And some of your patients who are lactose intolerant, they can actually digest small amounts of milk. Some patients, for example, I do okay with skim milk, but I avoid whole milk because whole milk just has too much lactose and it causes GI distress. All right, question number 31. What is an essential care step for a patient with a prosthetic limb? A, recommend that the patient skips physical therapy appointments. B, avoid cleaning the prostheses daily. C, encourage wearing the prostheses 24 hours a day. Or D, inspect the stump for signs of irritation or breakdown. And Charnay, I do hope you pass your test. Don't forget to read your report. It'll tell you what areas you need to focus on, and then ask your professor for more information, and make sure you really read the book and learn the terminology. Sometimes you all are failing simply because you didn't focus on terminology. All right, question 31. And the answer is yes. When you're in there giving that bath, you need to be inspecting that stump. So regular inspection ensures early identification of skin issues, improving comfort, and preventing infections. Question 32, we're going to questions 50. So if you've stayed here this long and you haven't subscribed to our channel, shame on you. Go ahead, hit that button, subscribe, and don't forget to like the video. All right, help a nurse out. All right, question 32. What type of fracture is most commonly associated with osteoporosis? All right, we're back on the orthopedic unit. Is it going to be an open fracture, a spiral fracture, a compression fracture, or a green stick fracture? What is a common fracture? Which one have you heard of before? That's probably the best answer. And yes, you are right. If you have heard of a compression fracture, you have it. So what happens during a compression fracture? So compression fractures, especially in the spine, are common in individuals with osteoporosis due to weakened bone structure. And so it starts compressing on the nerve. And so that would be your compression fracture. Everything is kind of like pressing down, and that's why your patients get shorter. All right, question number 32, everybody. And I see, yes, Jesus or Jesus, you can purchase our CNA book. It's on fltraining.com, and we have a tab that says CNA exam prep book. All right, so question 33, true or false? Lactose intolerance is more common in people of African, Asian, and Hispanic descent. True or false? Because we're telling people that, hey, you need to drink more milk because we want to prevent osteoporosis. But there are some populations who are lactose intolerant. And so we're not going to be recommending milk products to someone who is lactose intolerant. So is this answer true or false? Oh, we are torn. I see it's half and half. So everybody, it's true. So usually if they're brown, you don't want to assume, but if they have more melatonin in their skin, chances are they are lactose intolerant. So lactose intolerance is more prevalent in non-European populations, as genetic adaptation to dairy consumption is more common in people of Northern European descent. In other words, Caucasians can digest the lactose better than people who are not Caucasian. So keep that in mind when you're telling Mrs. Jenkins to drink more milk and she refuses. You got to find another way to improve her calcium intake, and that will probably be with legumes or nuts or fortified foods. Question 34. Sun exposure is the most natural way for the body to produce vitamin D. True or false? And vitamin D helps with bone, actually keeping your bones strong. So, is the sun a natural way to produce vitamin D? And if you chose true, you have it. Yes, baby, get some sunshine. So, the skin synthesizes vitamin D when exposed to UVB rays from sunlight. Just 10 to 30 minutes of sun exposure a few times per week can help maintain healthy vitamin D levels. And if you are that CNA who's working at a nursing home or assisted living facility, get those patients outside. If they can get in that wheelchair, push them outside, give them a few minutes in the sun, play a game with them outside, maybe some checkers or some chess, and then bring them back in. If or sit them by a window. But if they're always inside without getting any sunlight, yes, they're going to have weakened bones. All right, question 35. What is the best intervention for preventing falls in a patient with a musculoskeletal disorder? Now, earlier I was talking about you working on the orthopedic unit. A patient with a musculoskeletal disorder can be on any unit. They can be on the cardiac unit, they can be in ICU, they can be in your dialysis clinic. So, how do you prevent a fall? Is it A, keep the room well lit and free of clutter? B, encourage walking barefoot for stability? C, minimize use of assistive devices? Or D, reduce fluid intake to avoid nighttime walking? And I see you all are putting comments in there. It's just hard for me to monitor everything. So I'll go back and look at some of the comments in a few moments. All right, what do you think, team? Yep, that is your role as a CNA and also mine as a nurse. We got to keep the room lit. And most of your hospitals, there's going to be like a little night light, a floor light. And you want to make sure you keep things that the person can trip on out of the way. So ensuring a safe environment is critical in preventing falls, especially in patients with musculoskeletal weaknesses. Because remember, when they fall, they break something. Question 36. What is cellulitis? Is it a viral infection that causes blisters? Is it a chronic autoimmune condition? Is it an allergic reaction to irritants? Or is it a bacterial infection of the skin and soft tissues? What is cellulitis? Learn those medical terms. Think about the prefix. Think about the suffix. Think about the suffix. So the prefix comes before, the suffix comes after. And we are torn between A, B, and D. And for those of you all who chose D, yes, it is D. It is a bacterial infection of the skin and soft tissues. You all, the skin starts weeping. It doesn't look good at all. So cellulitis is caused by bacteria, usually Staphylococcus or Streptococcus, resulting in redness, swelling, and pain, and sometimes purulent weeping skin. And so we literally would put a bed pad beneath their leg in order to absorb some of that moisture, that drainage that is coming out from their skin. Felicity, I have no idea. I don't know, Felicity. It's late. I think Felicity is giving us other answer options. All right. So, which symptom is commonly associated with eczema? Is it A, pus filled blisters, B, scaly, itchy patches of skin, painful crusted sores, or circular rash with a red center? Oh, I see Felicity. We're on question 37 and she's I think she's starting at the beginning. She's on question 8. So which symptom is commonly associated with eczema? That's right, Annette and Mark. I see you and you have it. It is going to be those scaly, itchy patches of skin. So it is B. Eczema is not contagious. So, but when in doubt, you don't know what's going on with that patient, make sure you glove and gown up if you feel the need. But eczema or atopic dermatitis presents with dry, itchy, and inflamed skin patches. And I'm sure your nurse is going to be notifying the doctor so that we can get some type of medicated ointment to put on top of that irritated area. So everybody who's asking the questions at the very bottom of our here, let me add a banner and then that will help you all out. Doo-doo-doo. Just bear with me. Let me add a new banner. That's not right. So for all of you all who are asking questions about where to purchase the books, how to find our class schedules, here is the information. So even though it's at the very bottom, there you go. fltraining.com, fltraining.com. We have a wealth of resources. And if you click on the tab that says study guides and more, you'll see free printable practice test. So go to our website, you'll be able to order your books and get some free practice test. But question number 38. What is the primary cause of shingles? Is it A, reactivation of the chickenpox virus, B, direct contact with bacteria, C, prolonged sun exposure, or D, a fungal infection? And this one may be a little bit hard, so we're not going to prolong it, but your patients can have shingles. And if they have shingles, you need to make sure that you have on PPE because shingles is contagious. And so what is the primary cause of shingles? Yes, it is A. Yes, it's a reactivation of chickenpox. Lord, we can't have nothing. You would think you get chickenpox once, you wouldn't have to worry about it again, but nope. Shingles is caused by the varicella zoster virus, which remains dormant in the body after chickenpox and can reactivate later. And there's your image of those blisters, those painful pus-filled blisters that are contagious. So if you see that on the patient's body, wash your hands, get out that room, go tell your nurse, and then she will let you know what type of contact precautions we need to be putting that patient on so you can gown up, mask up, glove up, and go back in and take care of your patient. Question 39. Which patient is at the highest risk of developing shingles? Is it a 10-year-old child who received the chickenpox vaccine, a 25-year-old with no history of chickenpox, a 65-year-old with a history of chickenpox, or a 40-year-old with a fungal skin infection? And we got about 10 more questions to go. You all are rock stars. And I gave you this answer, so you know this. It's going to be the older person with a history of chickenpox. So it is going to be C. Question number 40. 10 more to go, you all, for part 1, and we'll do part 2 later this week. Don't ask me what day, because y'all know my schedule be crazy. All right, so which precautions should be worn when caring for a patient with MRSA, which is methicillin-resistant Staphylococcus aureus? In other words, they have an infection that is hard to kill with antibiotics. So it is antibiotic resistant. So if you're caring for a patient who has MRSA, a skin infection, what do you want? Is it droplet precautions, airborne precautions, standard precautions only, or contact precautions? So when you think of standard precautions, that's just, you washing your hands. Don't let linens touch you. Those would be like standard precautions. That's right. Everybody put D. Yes. We're going to glove, gown, and make sure before you put either of those on that you clean your hands. So MRSA is transmitted through direct contact with infected wounds or contaminated surfaces. And so you're going to put that patient on contact isolation and make sure you have on the appropriate PPE before you render care. This should be question 42, but it says question 41. All right, so what is a common symptom of cellulitis? We already know that one. It is going to be B, the red, warm, swollen skin. Question 42, true or false? Drinking cow's milk is the only way to get vitamin D naturally. And I already gave you an answer, so you know this. Revealing the answer in 5, 4, 3, Two, yes, it is false. So while fortified cow's milk does contain added vitamin D, there are other natural sources. Don't forget getting some sunshine, but they can get vitamin D from fatty fish such as salmon, from eggs, and also eating liver. And don't forget to get some sunshine. 10 to 30 minutes will improve your vitamin D levels. Question 43, true or false? People with darker skin need less sun exposure to produce enough vitamin D. Now, think about that. We get vitamin D from UV rays. When someone has darker skin, do they get more UV rays or less UV ray exposure? Darker skin, sun exposure. All right, revealing the answer in 3, 2, and it's false, everybody. Because I have darker skin, I may need to be in the sun a little bit longer. So, melanin in darker skin reduces the skin's ability to synthesize vitamin D from sunlight. As a result, individuals with darker skin tones may require more sun exposure to produce the same amount of vitamin D as those with lighter skin. Question 44. We're almost there, you all. We're on the home stretch. I'm so proud of you. A CNA is assisting a nurse with a wound culture. Which of the following should the CNA do? Is it A, hand the nurse sterile gloves and supplies, B, perform the wound culture independently, C, dispose of the swab in regular trash after collection, or D, remove old wound dressings without wearing gloves? Or D's just nasty. So we're not going to do D. And that's right, team. The only thing that you all can do from the list of options provided is going to be help the nurse out so you can hand him or her their supplies. So it is A. You cannot do the swab independently. You cannot do the culture. So CNAs assist in gathering the sterile supplies, but only licensed professionals can collect the wound cultures. Proper disposal follows biohazard protocols. So if you, depending on what's in that particular dressing or whatever you removed, your nurse will let you know if it can go in the trash or in a biohazard container. But be very careful because we just don't want this nasty dressing sitting in the trash overnight, being exposed to air and the bacteria growing. So unless your facility says otherwise, I would put that in a biohazard bin. Question 45. Which of the following is a common site for bed sores in bedridden patients? So those patients on the orthopedic floors, the ones who have had their orthopedic surgeries, the ones who have osteoarthritis, if you don't move them, what are they going to get and where? So where is the most common cause for a bed sore? Is it going to be the elbow, the heels, the palm of the hands, or the abdomen? That is right. I see you, A. So, all right. So I know A too. I do agree with A, but it is also B is the best response. But they can get the sores on their elbows. So you look for bony prominences. You look at any place where bone is touching bone or bone is touching bedding. So if you put A, I agree with you, and I also agree with B. So pressure ulcers often develop over bony prominences such as the heels, the sacrum, the hips, and elbows where the pressure is the highest. Question 46. What is the most important step in preventing the spread of MRSA? Remember, that is that infection that is resistant to a lot of antibiotics. So how do we prevent the spread of that type of infection? Is it A, wearing a mask, B, disinfecting with alcohol-based hand sanitizer, C, limiting visitors to the patient, or D, frequent and thorough hand washing? And you are correct. And And as a CNA who is taking the CNA clinical exam, where you have to do your physical skills in front of your nurses, I have been an evaluator for the state of Florida, meaning that I was the one who, based on the student's performance, would evaluate them and determine whether they passed or failed their CNA test, and then develop the whole curriculum to help people pass their test. One of the number one reasons you will fail your clinical test is hand washing. So make sure you wash your hands for 20 seconds before and after each skill, because you just using hand sanitizer alone does not kill all germs. So if the germ is not killed by the soap, the friction on your hand, whenever you're doing your cleaning of your hands, the friction should hopefully scrape the germs off. And then with the running water, you're going to run those germs down the sink. So hand washing is always the preferred way to prevent the spread of germs. Question 47. Which skin disease is often triggered by allergens or irritants? And Vandy said, wash your hands. Yes. Is it cellulitis, eczema, shingles, or MRSA? And this one's tricky. So I'm going to give you the way that I remember it. One of these disorders is like having asthma of the skin. And that disorder is, oh my God, you got it. I'm so proud of you. That disorder is eczema. Eczema is like having you're walking around with some type of, like, if you get pollen on you or something that irritates your skin, you're going to start scratching. You're going to get those flaky patches. So eczema flares are often caused by allergens, irritants, or stress. So it's like having asthma of the skin pretty much. Question 48, we're almost there. Which mouth condition is caused by a viral infection? Because remember, when you get to the skin, I need to finish the video. So part 2 will include hair. It's going to include more than what I'm covering right now. But is it going to be gingivitis, oral thrush, cold sores, or gum disease? What mouth condition is caused by a viral infection? Revealing the answer in 3, 2, and it's not oral thrush. Oral thrush is caused by sometimes medications, the overgrowth of bacteria on the tongue. So oral thrush is not caused by a viral infection. It is not B. Give me another answer. There you go. It is C, a cold sore. So cold sores are caused by HSV1 or herpes simplex virus 1. And so, y'all, those are contagious. So if you have a patient who's, especially during times of stress or illness, when their immune system weakens, those outbreaks of cold sores can be more prevalent. And so they've touched their lip, they touched their water pitcher, they touched their cup. And now you come in and you refill their cup and you touch their water pitcher. Guess what you have on your hands? Yep, you got herpes on your hands. So be very careful, wear gloves, and wash your freaking hands. I love you all. Let's stay beautiful. Let's keep our lips herpes free. All right, question number 49. What is the recommended PPE for dressing a wound infected with MRSA? So you may not be doing the actual dressing, but you're assisting the nurse and you're right there with him or her. You need to be dressed also. So what are you going to wear? Is it going to be A, gloves and mask only? B, gloves and gown only? C, no PPE is required? Or D, gloves, gown, and mask? This one's tricky. It is tricky, but not too tricky for my mark. I see you. All right, so you all, it's not D. Unless that wound is squirting or the wound is coughing, you don't need a mask on. to change someone's wound? Right. So the answer is B. If all you're doing is changing a dressing, it is going to be gloves and gowns. So gloves and gown protect against direct contact with the infected wound and contaminated surfaces. When you think about putting a mask on, that means that infection, that infectious, those particles must be in the air. It must be something that you could breathe in. And we made it to question number 50. So a resident in long-term care, in a long-term care facility has redness over the sacrum. That's the tailbone. That does not blanch. It doesn't get pale when pressed. So it just stays red. What stage pressure sore is this? Is it stage 1, 2, 3, or 4? Ooh, anticipation. What is it, team? Revealing the answer in 3, 2, and Barad, and Evie, and Elaine, and so many of you all have it. So if it's just redness, yes, you have it. It is A. It is stage 1. So a stage 1 pressure sore presents as a non-blanchable redness over intact skin. If untreated, it may progress to an open wound. And so I want to warn you, I'm going to show an image. All right, let me hide my photo. So here are the different stages. So stage 1, we talked about that redness. Now when it opens up and it's just like the first layer of skin that is open, that would be a stage 2. A stage 3 is when the ulcer goes into the muscle area. And then a stage 4 is when it goes down into the muscle and the bone. And yes, for some of your really, really sick patients, you can see their bone through the wound. And so these are the different stages. And notice how all these images are on somebody who is Caucasian. So it may present differently on somebody who is dark skin, whether that's a Hispanic person, a person from a different country, maybe from the Middle East. And so sometimes we don't turn red. It's just not going to look right. It's not going to be the same color as the surrounding tissues. That should be a reason for you to notify your nurse. And team, guess what we just did? We just did 50 questions on a musculoskeletal and an integumentary system. That's right. And so if you want part 2, I need at least 15 people to put the number 2 in the chat, and here I will help you out. And again, I don't know what day I'm coming back to do part 2, but I'm going to get back on here this week. And so I am so proud of you all. I will stick around for about another 2 minutes to see what questions you may have. And as always, I thank you all for staying up, for studying with me. We have people from all around the world on here tonight, this evening, and I appreciate you all so much. You're going to be awesome caregivers. I couldn't ask for a better team to help care for our patients around the world. I am so proud of you. All right, we got a lot of people saying good night. All right, we got a lot of 2s. Let me go back and count because I said 15. Oh, we have our 15. And then Better Line put like 2 like 6 times. So yes. All right, everybody, if you don't have any questions for me, good night. And I will make sure that I post. It's probably going to be last minute as always. We have a very busy training schedule. We train people 7 days a week. And then whenever I get an opportunity, I come online to my online team, my online family, and do these practice or review sessions with you. So I appreciate you all and I love you, and have a good night, everybody. For those people who are starting their programs tomorrow, I wish you much success. And for those of you all who are taking your test this week, I wish you much success also. All right, and I think I have one question. All right, so the question is it better to start off as a CNA or CMA if you want to be a nurse? I'm always going to advocate for the CNA route. Whenever you go to your nursing school and do a tour, and ask questions such as, does the CMA license count towards entering the nursing program? And most of those schools are going to say no, because CNAs don't draw blood. CNAs are usually not in just a strictly office environment. A CNA could work in the nursing homes, hospitals, home care. They're doing the hands-on direct care with the patients. They're learning communication. They're talking with the doctors. They're working with a different set of team members. And so usually CNA helps you get into the RN program, but CMA doesn't. But don't trust me. Don't take my word for it. Contact your local school of nursing, the one that you're interested in, and ask if being a CNA first gives you leverage or extra points towards admission into the RN or LPN program. And don't forget, you all, you can do anything for 1 year. So some states call it an LPN, other call it an LVN, a licensed vocational nurse or a licensed practical nurse. But in most states, that is a 1 year program. So you can literally go from CNA to nurse in 1 year. And then if you want to bridge over to become an RN from an LPN or LVN, that LVN to RN bridge program is another year. So you can do it in baby steps. That way you're not in school like every day of your life for 2.5 years trying to be an RN. So baby, it's CNA, LPN, RN, and then we're here to help you get there. So you all, I'm going to bed now. I love you and good night.